Hi, thank you for joining us. In this video, we will be teaching you how to take care of someone with shingles. My name is Susan.
My name is Marie.
My name is Cindy.
And my name is Felicia.
We are all nursing students at the University of California, Irvine. Before we begin, we would like to make some acknowledgements. First, we would like to offer a special thanks to the UCI School of Nursing, Division of Geriatric Medicine and Gerontology, and the Orange County Public Authority IHSS program. We would also like to thank our professor, Dr. Jung-Ah Lee, for her guidance in making this presentation possible. As a disclaimer, the information in this video are those of the author and should not be construed as an official policy or position of the HRSA, HHS, or the US government. Let's start with a brief overview of the video. First, we will talk about what shingles is, and then go into the symptoms and diagnosis. Then we will cover the treatment options available and talk about the different types of nursing care that you can do at home. What is shingles? Shingles is a viral infection that results in a painful rash with blisters. While it can occur anywhere on the body, it most often appears on the torso. It would appear as a single strip of blisters that wrap around either the left or right side. This is caused by the varicella zoster virus, which is the same virus that causes chickenpox. This virus can remain inactive for years before manifesting as shingles. Luckily, there is treatment and vaccine available. Next, I would like to welcome Felicia to talk about some myths about shingles.
So these are the 4 most common myths about shingles. Our first myth is that shingles is the same as chickenpox. This is untrue because although shingles is caused by the same virus as chickenpox, the varicella zoster virus, they are vastly different in characteristics and symptoms. Here we have a chart comparing shingles and chickenpox. First, shingles is contracted by people ages 50 and older, whereas chickenpox is often contracted in early childhood. Next, shingles is described as a painful localized rash, whereas chickenpox is a full body rash. Lastly, shingles can cause long-term nerve pain, hearing issues, and inflammation for months or years, whereas chickenpox is often mild and typically goes away on its own. Our second myth is that shingles can't be prevented. Shingles can actually be prevented because the shingles vaccine is available to people aged 50 and older. Older adults with chronic health conditions should especially consider receiving the vaccine. Our next myth is that if you have shingles, it's best to wait it out. This is untrue because it is important to notify your healthcare provider as soon as you suspect you have shingles. If not treated immediately, chronic complications such as burning or throbbing pain can occur. Antiviral medications are necessary to significantly lessen complications and progression of the disease. Our last myth is that shingles is not contagious. Although shingles itself is not contagious, the virus itself that causes it is. It can be spread easily by contact with skin blisters. Thus, it is important to keep the rash covered. Next, Marie will talk about the signs and symptoms of shingles.
So the risk factors for shingles. The risk for shingles commonly increases with age, especially those who are 50 years or older are at higher risk. People with previous history of chickenpox are at risk of contracting shingles as well. Lastly, any person with immunocompromised bodies are at higher risk, including those receiving cancer therapy, premature infants, organ transplant recipients, having HIV, taking medication that suppresses the immune system, and those who have undergone surgical procedures. How does shingles spread? Direct contact with the fluid from the rash blisters can spread varicella zoster virus to people who have never had chickenpox or never received the chickenpox vaccine. It is important to note that if unvaccinated people get infected, they will develop chickenpox, not shingles. However, those who contracted chickenpox can still develop shingles later in life. How to prevent spreading shingles to others? The most effective way to prevent the spread of shingles is to avoid direct contact with the rash and wash your hands often, especially after treating the rash. Cover the rash, avoid touching or scratching the rash, wash your hands often, avoid contact with the following people until your rash crests. Pregnant women who have never had chickenpox or the chickenpox vaccine, premature or low birth weight infants, people with weakened immune systems, such as people receiving immunosuppressive medications or undergoing chemotherapy, organ transplant recipients, and people with HIV infection. Symptoms and diagnosis. Shingles is a painful rash that develops on one side of the face or body, often in the shape of a single stripe. The rash consists of blisters that scab in about 7 to 10 days. The most contagious period is before the scab forms. Other common symptoms are fever, headache, chills, and upset stomach. These symptoms usually clear up within 2 to 4 weeks with immediate treatment. It is important to get the shingles vaccine to prevent the contraction of shingles. The shingles vaccine, Shingrix, is available to adults 50 years and older, including those who have other chronic health conditions. Shingrix vaccine consists of 2 doses, which are given 2 to 6 months apart. This vaccine is approximately 90% effective after the 2 doses and stays 85% effective for 4 years, according to the CDC. Even if you've had shingles before, it is important to get vaccinated to prevent future cases and severe symptoms. So it is important to know when shingles becomes a medical emergency. Usually a rash does not cross the body's midline. However, there are rare cases in which the rash can be widespread throughout the body, such as seen in the picture on the right. This condition is called disseminated zoster and is not normal. People with compromised or suppressed immune systems are at higher risk of contracting disseminated zoster. If you suspect that you or someone you know has disseminated zoster, contact your healthcare provider as soon as possible since this is a medical emergency. Now, Cindy will be discussing the various treatment options for shingles.
Drug treatments. The most common drug treatment for shingles are antiviral medications. These medications are important for shortening the length and severity of the illness. Some examples of antiviral medications include acyclovir, valacyclovir, and famciclovir. Prescribed medications from the doctor, such as antiviral medications, are to treat nerve pain and reduce the possibility of nerve damage, while over-the-counter pain medications focus on general pain relief. At-home nursing care. For caregivers taking care of individuals with shingles at home, some interventions include calamine lotion, cold compresses, and oatmeal baths. To keep the rash dry, do not apply topical creams. A non-adherent dressing can be used to cover the rash and help reduce the risk of onward infection. When caring for individuals with shingles, it is important to provide social support and assist with their activities of daily living to help reduce stress. Preventing transmission during care. Completely cover the lesions. Discard used bandages immediately. Wash cloth or linens that the patient used in hot water with soap. Remember to wear a mask and clean gloves. Alert anyone without immunity about risk of possible infection when interacting with the patient. Most importantly, make sure you're vaccinated. Calamine lotion is used to soothe itching or pain and helps to dry the oozing from blisters. It is a temporary solution and is available over the counter. It is important to consult with your doctor on the dosage and frequency of application. Here is a quick video on how to apply cold compresses.
You will need a bowl, some ice cold water, a clean washcloth, optional, some ice cubes, an ice pack, a towel. Step 1, fill a bowl with ice cold water. If ice cubes are available, add them to the bowl to make the water as cold as possible. Step 2, dip a folded washcloth into the bowl for about 10 seconds and then wring out the excess water. Step 3, Press the chilled washcloth to the inflamed area and keep it there until the compress loses its chill. An ice pack will stay colder longer than a washcloth, but wrap it in a clean cloth or towel first. It should never come in direct contact with the skin. Step 4, refresh your cold water supply if it loses its chill and continue dipping, wringing, and applying as needed.
You can also make a cold compress with either dish soap or rice bags. Next, here's another video on how to apply a non-adherent dressing.
Some road rash on her arm. The first thing that we're going to do is grab our triple antibiotic ointment, and I should say that this is after you've cleansed the wound, and there's lots of materials in the Traverse that can help you with that. So after her wound is nice and cleansed, we're going to open up the triple antibiotic ointment, and with a gloved hand, you're going to spread the antibiotic ointment along the entire aspect of the abrasive injury. And then the non-adherent dressing goes right on over that. Pretty simple, kind of like a fancy Band-Aid. This can be cut to size with the iris scissors that you'll find in the bottom of your kit.
And I can attest that this stuff works miracles on road rash.
So you just adhere it right along the top. It's kind of nice to have some extra padding, so I usually use a 4x4 over that, like so. And this is another great place to use your self-adherent wrap or your Coban. And the key point about Coban is that it sticks to itself and it's very stretchy. So you want to make sure you're not going to get it too tight, but just tight enough to keep things in place and keep people comfortable. So just like that. It rips really well too, but you can just use your scissors again. And then push it down in place like that.
How to give a colloidal oatmeal bath. Step 1, blend oatmeal into extra fine powder. Step 2, test a tablespoon of powder and see if it absorbs water. Step 3, pour powder into a tub of running water and stir. Step 4, soak for 15 to 20 minutes and gently rub the solution into your skin. Here is another video on how to prepare an oatmeal bath.
How to prepare an oatmeal bath. Are you or your child suffering from itchy or irritated skin? Use this simple remedy for skin comfort and anti-inflammation. You will need a coffee grinder, blender, or food processor, 1 cup of unflavored oatmeal, and a bathtub. Step 1. Grind oats on the highest setting of your blender, processor, or grinder. Add a tablespoon of ground oats to a cup of warm water. If the concoction turns milky and feels silky, you've ground the oats enough. Step 2, run a tub of warm water and sprinkle the oats over the bottom of the tub. Stir to break up any clumps. Only use 1/3 of a cup of oats for a baby's bath. Step 3, climb into the tub and soak for 15 to 20 minutes. Step 4, get out of the tub and pat yourself dry. Oatmeal baths can be taken twice a day or more. Let your skin celebrate. Did you know oatmeal has anti-inflammatory properties and has been used for centuries to soothe skin?
When to contact a doctor. The rash crosses midline or appears on new areas of the body. The rash spreads to the forehead, eyes, or nose. The patient develops a fever. Pain persists even after the rash is healed. The presence of 1 or more of these symptoms may indicate further serious complications. A common complication of shingles is postherpetic neuralgia. This is chronic pain that persists for longer than 1 to 3 months after resolution of the rash. Affected areas are typically sensitive to heat and cold. Elderly patients are especially at greater risk of developing this condition. However, early treatment of shingles can prevent postherpetic neuralgia. Another complication is vision problems. When an infection occurs near the eye, it can lead to temporary or permanent blindness. However, Lidocaine cream may be an effective solution for soothing long-term nerve pain. Next, Susan will lead a short quiz to test your knowledge about shingles.
For this quiz, we will be asking true or false statements. You may pause the video at any time to think about the answer and then click play when you're ready to hear. So first, shingles only develops on the torso of the body. This is false. Shingles can appear anywhere on the body. 2, rashes that cross the midline of the body are common and non-harmful. This is false. Rashes should not cross the midline of the body. 3, shingles can be spread through direct contact with the fluid from someone's rash blister. This is true. The virus is spread through direct contact with the rash. Number 4, wet compresses and colloidal baths are effective at-home treatments. This is true. Wet compresses and colloidal baths help reduce inflammation and pain. To summarize the presentation, we have put together a take-home message for you. So first, you should call a doctor immediately if signs of shingles arise. Starting early antiviral treatment can significantly reduce disease progression. 2, adults aged 50 or older should receive the shingles vaccine, even if they have had chickenpox in the past. This is to reduce severity and duration of shingles. And lastly, number 3, cover rashes to prevent the spread of shingles and wash your hands often. On this page, we have listed all the resources that we have used throughout the presentation. For more information, you can check out these links. We would like to thank you for listening to our presentation, and we hope you learned a lot about how to care for shingles. If you have any questions, feel free to email Dr. Jung-Ah Lee, and her email is provided on the slide here. Once again, thank you and have a good rest of your day.
Thank you.